As we age past 60, our bodies undergo significant changes that affect how we process foods, including fruits that were once considered universally healthy. The kidneys filter less efficiently, blood vessels become more fragile, and medications can interact with natural compounds in unexpected ways. Understanding these changes becomes crucial for maintaining brain health and preventing cardiovascular complications. Many older adults unknowingly create perfect conditions for health issues through well-intentioned dietary choices. The aging process affects insulin sensitivity, liver function, and blood vessel flexibility. What seemed harmless at 40 can become problematic at 70, particularly when combined with common medications for blood pressure, heart conditions, or diabetes. Consider how potassium-rich foods affect aging bodies. While potassium supports heart health in younger individuals, older adults often take medications that already influence potassium levels. When kidneys slow down their filtering capacity, excess potassium can accumulate, potentially affecting heart rhythm and blood flow. This becomes particularly concerning overnight when circulation naturally decreases and hydration levels drop. The relationship between natural sugars and aging blood vessels deserves attention. Many fruits contain concentrated sugars that rapidly enter the bloodstream. In older adults with reduced insulin sensitivity, these sugar spikes can trigger inflammation in artery walls. The body responds by forming small clots to repair microscopic tears in blood vessel linings. While this is a natural healing process, it becomes dangerous when vessels are already narrowed by age. Blood sugar fluctuations affect more than energy levels. Rapid spikes followed by crashes can cause blood to become more acidic and sticky. This places stress on the cardiovascular system and can contribute to clot formation, particularly in the brain's delicate blood vessels. The timing of fruit consumption matters significantly, as evening intake can disrupt overnight stability when the body is most vulnerable. Certain fruits contain natural compounds that interfere with medication metabolism. The liver's ability to process drugs decreases with age, and some fruit compounds can either accelerate or slow this process. This can lead to medication levels that are too high or too low, creating unpredictable effects on blood pressure, heart rhythm, and clotting factors. Citrus fruits, for example, contain compounds called furanocoumarins that can significantly affect how the liver processes various medications. These natural chemicals inhibit cytochrome P450 enzymes, which are responsible for metabolizing many common prescriptions, including statins, calcium channel blockers, and certain blood thinners. When these enzymes are blocked, medications can accumulate to dangerous levels in the bloodstream, even when taking prescribed doses. The interaction between natural compounds and medications becomes more pronounced with age because liver function naturally declines. The liver's ability to produce the enzymes necessary for drug metabolism decreases, and blood flow through the liver reduces. This means that even small amounts of interfering compounds can have significant effects on medication levels. Furthermore, older adults often take multiple medications simultaneously, a practice called polypharmacy. When natural fruit compounds interfere with the metabolism of one medication, it can create a cascade effect that influences how other drugs are processed. This can lead to unexpected interactions between medications that would normally be considered safe when taken together. The timing of medication administration relative to fruit consumption can also affect these interactions. Some compounds in fruits have effects that last for hours or even days, meaning that the interference with drug metabolism can persist long after the fruit has been consumed. This makes it difficult to predict when it might be safe to take medications after eating certain fruits. Dehydration represents another hidden risk. Some fruits have natural diuretic properties, increasing urination frequency. For older adults already taking water pills or similar medications, this can lead to overnight dehydration. When the body loses too much fluid, blood becomes thicker and moves more slowly through narrowed vessels, increasing clot formation risk during sleep. Acidic fruits present their own challenges. High acid content can trigger silent reflux in older adults, often without the typical burning sensation. This can cause microaspiration during sleep, leading to reduced oxygen levels and increased morning stroke risk. The combination of acid, sugar, and natural enzymes can create multiple stress points in an aging system. Natural blood-thinning compounds found in certain fruits can interact dangerously with prescribed anticoagulants. While beneficial in isolation, these compounds can push blood thinning beyond safe levels when combined with medications. This creates risk for brain bleeding, particularly in vessels already weakened by age and blood pressure fluctuations. Pesticide residues accumulate differently in aging bodies, creating long-term health implications that extend far beyond immediate toxicity concerns. The liver and kidneys process environmental toxins more slowly with advancing age, allowing chemical residues to build up in various tissues, including the brain, nervous system, and cardiovascular structures. Over time, this accumulation can weaken blood vessel integrity and contribute to neurological inflammation, creating conditions that favor clot formation and increase stroke risk through multiple pathways. The blood-brain barrier, which normally protects the brain from harmful substances, becomes more permeable with age. This increased permeability allows pesticide residues that might have been excluded in younger years to reach brain tissue, where they can interfere with normal neurological function. Many pesticides are neurotoxic, meaning they specifically target nerve cells and can disrupt the electrical signaling that controls everything from heart rhythm to blood vessel dilation. Modern agricultural practices often involve the use of multiple pesticides simultaneously, creating complex chemical mixtures that may have synergistic effects not seen with individual compounds. These cocktail effects are poorly understood and rarely studied in relation to aging populations. The cumulative impact of multiple low-level exposures over years or decades may be significantly greater than the sum of individual effects, particularly in older adults whose detoxification systems are already compromised. Organophosphate pesticides, commonly used on conventional fruit crops, work by inhibiting acetylcholinesterase, an enzyme crucial for proper nervous system function. While acute poisoning from these compounds is well documented, chronic low-level exposure can lead to subtle changes in cardiovascular regulation, blood pressure control, and cognitive function. In older adults, these subtle effects may tip already fragile systems toward dysfunction. The fat-soluble nature of many pesticides means they accumulate in adipose tissue and can be released into the bloodstream during periods of weight loss or metabolic stress. This creates the potential for delayed toxic effects that may appear months or years after exposure. For older adults who may experience unintentional weight loss due to illness or medication side effects, stored pesticides can suddenly re-enter circulation at potentially harmful levels. Inflammation markers consistently show elevation in individuals with higher pesticide exposure levels. This chronic inflammatory state affects blood vessel health throughout the body, contributing to atherosclerosis progression and increasing the risk of both ischemic and hemorrhagic strokes. The inflammatory response to pesticide exposure may persist long after the chemicals themselves have been cleared from the system, creating ongoing cardiovascular risk. Individual genetic variations in detoxification enzymes create significant differences in pesticide susceptibility among older adults. Those with slower functioning variants of cytochrome P450 enzymes or glutathione transferases may accumulate pesticide residues more readily and experience greater health effects from the same level of exposure. These genetic differences become more pronounced with age as overall enzyme function declines. Inflammation markers increase with certain fruit consumption patterns. High sugar varieties, or those with natural compounds that trigger immune responses, can create chronic low-grade inflammation. This affects blood vessel health and can contribute to the gradual narrowing of arteries that supply the brain. The solution involves mindful fruit selection and consumption timing. Lower sugar varieties consumed earlier in the day provide benefits without overwhelming aging systems. Pairing fruits with protein or healthy fat slows sugar absorption and reduces spikes. Understanding medication interactions helps prevent dangerous combinations. Safer alternatives include berries with their lower sugar content and high antioxidant levels. These support brain health without dramatic blood sugar fluctuations. Green apples offer nutrients with minimal glycemic impact when eaten with protein. Avocados provide healthy fats that support cardiovascular function without sugar concerns. Portion control becomes increasingly important with age. What constituted a normal serving at 40 may be excessive at 70. Smaller amounts consumed at appropriate times can provide nutritional benefits while minimizing risks associated with sugar spikes, medication interactions, and inflammatory responses. Hydration considerations must account for both the fluid content of fruits and their potential diuretic effects. Balancing fruit intake with adequate water consumption throughout the day helps maintain proper blood viscosity and circulation, particularly important for overnight cardiovascular stability. Professional consultation becomes essential when managing multiple medications alongside dietary choices. Healthcare providers can assess individual risk factors and recommend safe fruit consumption patterns based on specific health conditions and prescribed treatments. The goal remains enjoying life's pleasures while respecting the body's changing needs. This doesn't require eliminating all fruits, but rather approaching them with knowledge and caution. Understanding how aging affects food processing empowers better choices that support long-term health and independence. Recognition of warning signs allows for prompt intervention. Morning dizziness, occasional confusion, or balance issues may signal that dietary patterns need adjustment. These subtle symptoms often precede more serious events and deserve medical attention. Ultimately, successful aging involves adapting habits to match current physical realities. The fruits that supported health in earlier decades may need modification or replacement to continue serving well-being in later years. This adaptation represents wisdom rather than restriction, allowing continued enjoyment of food while protecting vital organ function. Each individual's tolerance varies based on genetics, health history, and current medications. What affects one person severely may be tolerable for another. This emphasizes the importance of personalized approaches to nutrition in later life, guided by healthcare professionals who understand the complex interactions between aging, diet, and medications. The key insight centers on balance and timing rather than complete avoidance. With proper knowledge and careful attention to body signals, older adults can continue enjoying fruits as part of a brain-healthy diet while minimizing risks associated with sugar spikes, medication interactions, and cardiovascular stress. Prevention remains more effective than treatment when it comes to stroke and cardiovascular events. Small adjustments to fruit consumption patterns can significantly reduce risk while maintaining nutritional benefits and eating pleasure. This proactive approach supports the goal of aging successfully while preserving cognitive function and physical independence.